who knew the decision to take antibiotics before a dental procedure post total knee replacement could bring up so many different perspectives. My video yesterday about my kind of surprise at learning that I'll have to take antibiotic before for amoxicillin before any dental procedure and or any skin barrier procedure like going to the dermatologist or having a colonoscopy or having a piercing or something, as a precautionary measure. I was like, wow. And then so many of you were like, that's not true. You don't have to do that. And I love hearing everyone's perspective and opinion. But what I'm confused about is if the guidelines have truly, in fact, changed, which some of them have, why are dentists and surgeons and doctors still using that as a precautionary measure? Like, and then I think it's a precautionary measure, meaning it it's like a is it I would think of it like I'm not a medical person, I'm not a doctor. Okay. So, I mean, yes, I can read the research and I can make my own decisions and I fully support that. But at the end of the day, if it's a precautionary measure, why would I have a problem doing a taking a precautionary measure? Like, if I go on a boat and I wear a life jacket, it doesn't mean I'm going to drown. It doesn't mean that it could save me from drowning if in the right circumstances I could maybe still drown, but it's a precautionary measure. So I guess I just look at it more like I guess it's being still used. When I asked my doctor, he's like, "Well, we still use it as a precautionary measure." It He cleans out infections all the time and they still use it as a precautionary measure. I guess that's where I'm landing. It's frustrating being on the other side because there's you're all the doctors and dentists, everyone gives different advice. So sometimes it is hard to know what the right thing to do is. But that being said, obviously I'm gonna do what I want to do. I'm gonna, I am okay, right? For right now, I'm freaking 23 weeks post total knee replacement on both my knees. I'm just gonna this year I'm gonna keep using it as a precautionary measure, and I will check back in every year with my doctors and take consensus and do what's right. And you definitely need to do what's right for you. Don't get your medical advice from freaking TikTok. However, it can maybe make you think about something and go research it. But I don't know. It's frustrating. It's frustrating that we're all told different things because then none of us want to. First of all, none of us want an infection. None of us want to be flippant about taking care of you go through all the surgery, the rehab, all the work. The last thing I want is to, experience, have an infection. So, like, of course, I'm like, sure, this is what I need to do. That seems easy enough. And I know there's the question of like, well, will you build up like there is a real there is a real risk of like if you're taking antibiotics too much when you finally need it, it won't work. However, my doctor said, "Well, how many times a year are you going to be doing that? Once or twice?" Like he said, taking one dose once or twice a year is not a risk for antibiotic resistance. But if you're having multiple procedures and you're having to take multiple antibiotic on top of other things, yes, that is a concern. Anyway, the point is there's so many variables for everyone, so many variables. And so we can't cover all of them. Like you don't know all my variables. I don't know all your variables. I don't know your medical history. I don't know why your doctor or why my doctor um, takes precautionary measures the way he does. But um, it's just been interesting. It's interesting to hear all the different feedback. No wonder we're so confused sometimes on what's right for us, right? Because like we're not all on the same page. Anyway,